Good afternoon, everyone. I'm Cervical, Medical Laboratory Science graduate from the University of Buhura, and today I'll be presenting one of my research findings titled Diagnostic Performance and Durability of a Modified Papanicolaou staining method for cervical screening, a cost-effective method for assessing disease. Let's dive into the slides. Cervical cancer is one of the most common cancers in the world, and in Sri Lanka, it is the second most common cancer among women. So the important fact is that cervical cancer is highly preventable and curable if detected early. So there are so many screening tests in the world, but still pap smear remains the most commonly used method because it is considered as cost-effective, simple, and reliable for detection of early precancerous cells. But however, have you ever thought what's the real meaning of this cost-effective in a developing country like Sri Lanka? Because the standard method requires a high amount of alcohol, about 6 liters per annum, and 1 liter costs more than 2,000 rupees. With that mentioned challenges, my research inspired to find whether a modified method could maintain the diagnostic quality while being more affordable and safer laboratory environment. With that objectives, let's move to the methodology. This study consists of two parts, a prospective method and the retrospective method. A prospective method evaluates the effectiveness of the modified method, while the retrospective method evaluates the durability of the previous staining slides using the modified method. The study setting was the histopathology laboratory, District and Hospital Mandara. For the prospective study, cervical smears were collected by the medical officers from the consented women. 2 smears were collected from one woman, and they were fixed immediately and transported to the laboratory. And in the laboratory, 2 slides from one woman selected randomly for both staining methods. One stained with modified method and another one stained with standard method. Here, I have shown the steps of conventional method and modified method. I have colored in red the steps. Some steps in conventional method. There are so many steps consuming alcohol, but here in modified method we try to omit these alcohol and replace it with normal tap water. After the staining procedure, we screen the slides blindly to the staining protocol by the primary investigator. 2 cyber screeners, and the results were confirmed by the consultant histopathologist. So here we try to evaluate various cytomorphological parameters by using a scoring system defined by Gashi in 2011. And normally in cytology we are using values, quantitative values, but here, so you can see in this table, Gashi was trying to give a score, a value for several cytomorphological parameters like cytoplasmic borders, cytoplasmic staining, nuclear borders, and chromatin staining. Looking at the table, you can see score 3 is the highest score can be obtained by a cytomorphological parameter. And after that, the scoring was done, and the staining method was revealed, and results were decoded according to the results. Again, a quality index developed by Chan in 1988 was calculated. This is also a quantitative method to analyze the cytomorphological quality in cytology. So, and the prospective study, we use paired t-test to evaluate whether there is any difference between the standard method and modified method. And for retrospective study, we use 250 modified method staining slides randomly selected, and we use ANOVA to see whether there is any difference over the years. And for both prospective and retrospective method, we use a reference smear chosen according to the International Academy of Cytology atlas. And for that So quality index was calculated for past 5 years. And let's move to the most important part of my study. This is the results section. We collected totally paired 161 smears, and among them only 152 smears were satisfactory for screening. Among them, when compared to the cytoplasmic borders, the standard method shows 98.7 distinct borders, while the modified method showed 96.7%. So it has obtained the maximum score, score 3, distinct cytoplasmic borders. And when it comes to the cytoplasmic stain by both standard and modified method, the standard method showed 60.5 smears with satisfactory staining, whereas the modified method showed 57.2 stain with satisfactory staining. And the other interesting point is that when it comes to the nuclear borders, all the slides stained both standard and modified method show score 3 means the distinct nuclear features. So here it is very important because in cytology we are looking for abnormal cells. The key area to look in the cell is the nucleus. So having any deviation from the nucleus from the normal cell, we can identify whether there is a precancerous cell or a normal cell. So we were trying to calculate the quality index. In comparison to the highest quality index obtained is 1. According to that, the quality index of standard method was 0.932 and quality index for modified method is 0.911. And paired t-test showed that there is no significant difference between both cytological staining. And I have added some graphs for your reference. I think there's no time to explain. But here, there's unfortunately, we were able to find a low-grade squamous interepithelial lesion from one woman. So these two slides you can see I have pointed out the abnormal cells. It is stained by standard method and modified method. So we were able to identify these abnormal cells by staining with two staining methods. So the other important fact of my study is the cost effectiveness. As I mentioned you earlier, the standard method requires high amount of alcohol, while the modified method requires less amount of alcohol. So by running this method, we were able to save like 18,000 rupees from one run. And this is about the cytoplasmic preservation. So I just wanted to conclude that. So we know the cervical screening was done in Sri Lanka widely as a screening method. So thousands of smears are stained from one run. So even we can save 1 cent from a slide. So there will be a huge reduction of nationwide cost. So that's why I want to highlight. So this staining method can be used as an alternative for standard modified Papanicolaou test. So I would like to acknowledge my supervisors and all the staff in this pathology laboratory and all the staff in remote areas and the participants. So these are some of my references and thank you very much for your presentation. Thank you.
Great, thank you so much for that very nice, comprehensive presentation.